Hi Tony, nice to meet you again.
Hi, how are you
Dr.
doing?
Kelly's my name.
Hi, Dr. Kelly, yeah.
How are you, Tony, today?
Not too bad, yeah, not too bad.
You've come on your own, have you?
Yeah, I came on my own, yeah.
Sure.
Is that all right? Yeah. Okay.
You know why you're here today, do you, Tony?
Get the results of that x-ray thing I had.
That's right,
Yeah.
that's right. So you were into me last week, and I suppose with being an ex-smoker and you'd lost a bit of weight, isn't that right? Is that fair to say?
Yeah, I was delighted with that, finally, a bit of weight shifting, yeah.
Right.
Yeah.
And I suppose the biggest symptom that you had was the cough, which was going on for about 3 months.
Yeah.
So we were, I suppose, both a bit worried about that, so we sent you for the chest x-ray.
Yeah.
So that's come back to us.
Okay.
And there is something on it, Tony. Okay?
Oh, goodness, okay.
Yeah. I don't mean to alarm you, but I want to
Yeah.
explain a little bit about what's come back.
Oh, goodness, okay.
All right?
Yeah.
So
Yeah.
I suppose with all those symptoms that you have and the fact that you're an ex-smoker, we decided to do the chest x-ray to look if there was anything worrying on it. And the report has come back that in the top of the right lung, there's what they describe as a lesion.
Oh, God,
Okay?
I've cancer, doctor.
That's not what it means, okay?
Okay.
The chest x-ray is good at showing something in the lungs, but it's not good at showing what it might be. So we don't know that it's cancer, Tony, all right?
Okay, but
Now-
it could be.
It could be cancer.
Okay.
I have to be honest with you. That's one of the things that we think about. So we think about what it might be or the differential diagnosis. One of them is cancer.
Okay.
But I can't tell you, Tony, that this is definitely cancer, okay? You're going to have to undergo further tests. I know this is very
Okay.
shocking for you and you weren't expecting it, okay?
Okay.
But I thought I have to be honest with you what we see.
Yeah, no,
All
I
right?
understand that. Oh, goodness.
Before I
Yeah.
go on any further, do you have any questions, or I'm sure you have loads?
Oh, I think right at the minute, nothing's coming to mind except I've got cancer. Yeah.
Okay.
Even though I know you said that that's not
I
entirely
know.
the case, but that's all I'm thinking at the minute, to be honest. Okay.
I understand
And like,
that.
I had, apart from the cough, and I gave up the cigarettes. Like, I wasn't expecting this at all. Like,
I know you'd given up a
Yeah.
few years ago, but
Yeah.
and as I said, I want to reiterate again, we don't
Yeah.
know that this is cancer. So what's going to happen from here are a few things to
Okay.
work out what exactly is that, what they call lesion in the top of your right lung. Okay?
Okay. All right.
So I'm
what's
going to
next?
explain this to
Yeah.
you a few times.
Yeah.
And don't worry if you don't take it all in today, because it is a lot to take in. I want you to come back at any stage over the next few days with a family member or a friend, whoever you want to bring back,
That's
and
a
I
good
can
idea,
explain all
yeah.
this again, okay?
Yeah.
So what we do from our end, you don't have to do anything. We do all the referrals to the specialist centre nearby, okay?
Okay.
So there's what's called a rapid access lung unit in the local hospital.
Okay.
And we send a referral to them saying,
Okay.
telling them your history of what you came in with, the cough and the weight loss, although you know it was intentional,
Yeah.
and the fact that you were a smoker, along with the x-ray result. Okay? We give them all your details, so your phone number and your address. They'll then contact you, usually within the next 2 weeks,
Okay.
and bring you into the hospital.
So they'll see me in 2 weeks. Okay.
Within 2 weeks.
Within 2 weeks.
So that could be
maybe
a few
quicker.
days,
Okay.
or up to 2 weeks. If
Okay.
you don't hear anything within the next 10 days, I want you to give me a ring. But
Okay.
hopefully you'll be into me before that, so we can
Okay.
discuss it more.
Yeah, because I won't
Yeah.
remember all this.
You
yeah,
can always,
yeah.
I understand it's very difficult to take all this in one go.
Okay.
You can bring anyone you want with you to the appointment. You'll meet
Yeah.
a consultant,
Okay.
and what they'll do is they'll ask you a little bit about the history that I've asked you. They'll examine you, and then you'll undergo some more specific tests to see what that thing is.
Okay.
More than likely, you'll have a CAT scan, which is the big tube that you go in, the big dome.
Okay.
That can be quite loud. And that's
Okay.
better at seeing exactly what's going on in the chest on that right side. Okay? And the other thing that you may or may not have at that appointment or near that appointment is a camera down into the lung
Oh, goodness. Okay.
to directly visualize that and perhaps take what's called a biopsy or a piece of tissue from that, what they call lesion, to see exactly what it is under a microscope.
Okay.
Okay?
Yeah.
So again, I know that's a lot to take in. And again, is there anything that I've said that you don't understand?
No, I think you're explaining it really well. If it's not cancer, what else could it be?
There's a number of things that it could be. It could be things like an unresolving infection. It could be inflammation at the top of the lung. It could be some old scarring of the lung. Okay. Or it could be, there's two types of what we call cancer. There's benign and then the more worrying one, which is malignant. And we don't know what any of it is until we get a piece of tissue and look at it under a microscope. Okay. And then looking at the surrounding lung on the CT scan or on the CAT scan. All right. So I want to be honest with you and tell you that one of the things that they will be thinking about is that it could be cancer. But I don't think you should take that home today thinking that you definitely have cancer, because that's not what I'm telling you here. All right?
Yeah. Okay.
Now I know that's difficult, and you'll probably have loads of different questions over the next few days, and maybe writing them down and bringing them in with the family member. You can come to see me anytime you want.
Will you help me tell my husband? I don't think I can tell him.
Absolutely no problem. If you'd like to bring in your husband at a time that suits you, if you just let me know before you come in, I'll book out a double appointment.
With extra time,
Bit of extra time.
Yeah, I don't think I can tell him,
And you can let me know how much or how little that you want. Do you want me to be completely honest with your husband, or do you want to direct the consultation yourself?
Okay, I'll think about that.
Yeah. I think it would be good if you brought someone else with you. It's always good if you have some family support, not only into the practice in the next few days, but also to that outpatient. It can be quite daunting. You probably meet a number of members of the team. You may have even some more blood tests done. But again, I don't want to tell you exactly what you're going to have in the day, because I'm not exactly sure.
Okay.
All right?
Goodness.
So just to go over things a little bit again, do you understand about what I've said to you today? Because it can all be a bit shocking, I suppose.
Yeah, no, I understand that there's something on the chest x-ray and it could be serious. So things are going to have to act fast. So I'll hopefully be seeing someone within 2 weeks, and they'll find out more then. Absolutely.
As I say, you're undergoing further tests, and then hopefully we'll find out pretty quickly after that, after you have those more specific tests, what exactly that is. And depending what that is, then we'll be able to tell you your treatment and what that might entail in the future for you. Okay? Goodness, before we go on, this is obviously very shocking. I'm not sure, are you working at the moment, Tony?
Yeah.
What do you think about taking a few days off work, possibly?
I suppose that's a good idea, I don't think I'd be able to concentrate today anyway.
Very difficult. So what I'll do is,
a good idea.
I'll give you a note today maybe. Some people find that it distracts them actually going to work, and it keeps their mind active. Other people, they just can't concentrate. So what I'll do is I'll give you a note today, but if you need that, I'll give it for the next 2 to 3 days, let's say. But if you need it longer than that, it's absolutely no problem.
Thanks, Doctor. That's good.
All right?
Yeah.
Is there anything else before I let you go?
No, I think that's enough to digest for the minute, and sure we'll be in touch in the next couple of days.
Great, and I'd be more than delighted to see you with your husband and anyone else that you want to bring.
Thank you.
All right?
Yeah, thank you.